Tugdug. Tugdug. Hey guys, it's Paul and welcome to another vlog. So for today, hinihintay na lang natin. we're just waiting for my dad's post-op surgery. He is currently at the post-op area, but oh, it's blinking. But then the nurses said now we have to wait for a couple more hours or minutes until we can see him at the recovery room. So he just came out of a surgery. The surgery is called SEPTORHINOPLASty. It is done for a medical reason for him, kasi to improve his breathing. And so right now we're just waiting for him. And here's my mom. Mom, have you done your rosary already? Have you done your rosary already? You know, kailangan din natin, we need to pray sometimes. Especially her. Yeah.
We already listened to the
To what?
mass this morning, early morning.
You
when
did?
We woke up. Of course.
As if it is a major surgery, no? So yeah, we're just waiting here. And then let's see mamaya if he's kind of a little bit groggy, or let's see if he'll speak something weird after the surgery. So we are still here at the waiting room, and yeah, it's taking pretty long for him to be moved to the recovery area. And since it takes it so long, someone here is kind of nervous already. She said tagal naman ni Papa. Huh?
From 7:40 in the morning until
Until
now,
what?
it's 1:32. Still
Yeah.
on post.
And post, yeah. But actually, we are really expecting it to be done at 2 p.m. or something. Because the doctor said about 4 to 6 hours, since this is not just rhinoplasty. This is septorhinoplasty. It is a different procedure na compared to other procedures na like yung rhinoplasty na just take about 4 hours lang or less. For this one, it took him a little bit longer. Especially na he chose a cartilage from his ribs and not from the ears. So maybe that kinda played a role in the duration of the procedure. I don't know, we don't know. We'll see later at the recovery area, and then we'll ask a couple of questions. But for now, we are kind of like a relative role, and then later on, tonight or after we see him, our role will be private duty nurses. At least he got to private duty nurses later. So yeah, we'll update you again later on. Keep praying. Just keep praying, keep the faith. So we are now here at the recovery area, and Maya is currently doing the praying. She's praying over my dad right now. See him? Right there. Okay, alright. It seems like he's not groggy or something. It's kind of normal. Yeah.
Is there drainage? Seepage?
Alright, so now my dad is back here at the recovery room, and my mom is here. Mom, let's come here. Dad. We're trying to have some conversation with him in here. Pa, how are you?
Fuck me.
How do you feel right now?
I got hit by a bus.
They really got hit by a bus. What's that on your nose?
I spent all the money for your nose job for me.
Right, there he is.
I feel so weak.
You do?
I can't lift my arms hardly.
Hmm. Can you try lifting your arms or your feet? Give us a sample.
Sorry
Sama.
about that.
Let's go.
1.
Alright, 2, 3. Alright. Very good. And
she?
it's him right here. Oh. Who is she? Who is she though? Who are you though, ma? I don't know.
You're mistress.
That's like housekeeper.
She's what housekeeper? She said she's your mistress.
Which one? I have 7.
Serve. Serve your master. Sir, why can't you hold your own coffee?
I can't lift my arm.
Why are you crying?
This product is really damaged right now. But there is no return, no exchange policy. What do we do now?
I lost a receipt from Mom a long time. Stuck now.
Oh, sorry.
They did the wrong one. They should have done her.
Yeah. Ma said it should have been me.
Never mind. Never mind to have flat nose.
If you ever drink for the whole weekend and then you have hangover Monday, that's what it feels like.
Is it? That's how it feels like?
Yeah.
Huh.
Thirsty and dizzy.
Yeah. Mm-hmm.
No pay though.
For now.
Yeah.
For now, there's no
Oh,
pain.
thanks, Mr. Optimist.
So, ma, after seeing him like this, would you still
No.
wanna get some rhinoplasty in your
way.
nose?
No.
He doesn't wanna get it anymore.
Why are they? Do we have to buy the water here? Why are they so cheap with the water?
I can ask. Wait. Ask for water. How are you doing so far, sir?
Fuck.
Would you recommend having this procedure to everyone?
Did you get the license plate of the bus that hit me?
Oh, I think I didn't get that. So right now we are doing the post-op cleaning of past wound. As you can see in here, here's the suture, and then we really have to remove the dried blood. Kasi sometimes it gets really hard. How's our patient?
Pacquiao's. I should have insulted you.
Q-tips, ano?
Oh, it's not like you're dying.
Are you okay, Papa?
Just itchy throat.
Mm-hmm.
Also, you might be wondering why I'm not wearing any gloves, but I did use some alcohol, so I think that would suffice it. I mean, I should be wearing some gloves since we don't have one at home. The alcohol, trying to remove the dry blood in here, the clotted blood. Sometimes it's kind of hard to remove, and then sometimes past it, it's painful.
How many hours was I on surgery?
Oh, I cannot see the...
He was in surgery for what?
5 hours?
Yeah, 5 hours or more. That's not, I mean, the post-op and the recovery area part was not yet included in that one.
We arrived at 5:30. The surgery started at 7:30.
Still hard.
Yeah.
It did.
I woke up at like 3,
Mm.
2 or 3, I don't know. We left at 5, I guess, 4:45. Almost 12 hours. And I can't talk right now because the
Do we
drugs
have more of the color?
the drugs are wearing
Yeah.
off, and my throat's really sensitive now from the breathing tube.
Also, we noticed the change of your voice right now. You really sound like you're having a hoarseness of voice. But that's normal when you do general anesthesia and then you put a chew on you.
The Palixin.
So there is a scheduled medication for, I mean, he should take antibiotic for 7 days. It is 3 times a day. The order is 3 times a
Yeah,
day.
3 times a day.
So that means it's every 8 hours. And then the other one is a combination of acetaminophen and codeine for his pain.
30 milligrams.
Yeah. And he'll be taking it at least 1 to 2 tabs every 4 hours. So this is how you prepare the gauze. The gauze nose. Get a gauze pad and then fold it into 4. Get your tape. And you
Okay.
put this one in here just to catch the blood. And to prevent it from
Okay.
Dripping.
That's good.
Yeah. Hello. Welcome back to our 7th day.
So I guess about 30 hours after the operation.
Mm-hmm.
So I had the surgery Tuesday morning, now it's Wednesday night. So luckily, not much bruising, just a little bit black eye. Just the nose is really swollen. The throat's a little bit better.
Yeah.
And the wound on my chest, not so bad.
Chest part.
So the pain isn't really bad at all up here. It's just feels like a stuffy nose, or like I got punched in the nose maybe, but it's not horrible.
So for his case, the pain is tolerable?
Yeah.
How would you grade your pain since yesterday?
I'm on the 10, maybe 2, 3.
Yeah. And you're taking pain medication, right?
I take it when I need to, but I'm not doing it regularly.
Mm.
Like the bottle says every 4 hours, but I'm like every 8.
Mm-hmm.
You know, and even then it's not pain, it's just uncomfortable. It's like itching or swelling, feeling pressure, but not pain.
Yeah.
I mean, I could totally do without the pills if I needed to, but... So that's day 2. You know, no pain, hardly. Just stuffy nose, uncomfortable, scratchy throat. Throat's better though than yesterday. And there's a big sore where I guess the tube was sticking, and then they ripped the tube out and it took the skin from my lip with it. You know, so that sucks. And I didn't sleep much last night, just napped on and off, so tonight I might take this Z-Quil stuff just to knock me out a little better. I didn't take it last night because it said the codeine would make me drowsy, but I wasn't tired at all, so. Other than that, not so bad.
And he was snoring a little bit last night. But
A little bit.
it's kind of normal since he still has the splint and then the tube inside his nose. So, and then he is scheduled for the removal of the splint after a week. We have to go back to the doctor.
And there's Mamacita. Oh, those are compression socks.
Oh, that's mine. It just has your name in it, but it's mine.
Do opening
Opening.
opening video. Unboxing.
Yep. Open my compression socks.
From Figs.
Yeah.
So these are recommended for all nurses.
Especially if you are risk for having varicose veins.
So this is paid sponsorship by Figs.com.
I hope so. I hope.
Oh, sexy.
Yeah,
Not too big?
no, just exact.
Huh. He got his license approved. He's just waiting on it. I guess they're waiting on his fingerprints to go through.
I gotta check it this morning, but then I didn't see.
So he has his socks. He has one pair of scrubs, but we probably got to give him more.
Yeah.
So day 3, I had the surgery on Tuesday morning. Now it's Thursday morning. So the swelling got more up here. And I woke up this morning, my eyelid was filled with water. It was all swollen up there, I could hardly see out of it. But since I've stood up a couple hours now, it's kind of gone away. My throat still hurts. There's really not much change from after the surgery. I didn't want to keep taking the pain meds, but I'm kind of forced to. The throat's still sore. There's really not much difference. My appetite is good. I was able to take a kind of a hand wash shower the other day. I tried using an ice pack on my forehead to help bring the swelling down. But it's not really painful, it's just uncomfortable. Like I have like the flu with a sinus headache and stuffiness, but it's not really much pain.
Hello. So we are now on our day 3 of post-op surgery. And then, just cleaning it a little bit. Then he said Still have the same feeling as the first few days of his operation. And then what else you got today?
More swelling.
More swelling. Now when you look closely, you see the swelling here on his eyes. And then a little bit here and here on the side. But he's already using the cold compress now. That will help a little bit. And right now we're just gonna put some ointment. Bacitracin ointment. It is an antibiotic ointment that we put after cleaning the wound.
So today's day 4. This is Friday afternoon, 12 o'clock. I stopped taking the pain meds last night because just didn't really feel anything.
Yeah, and the swelling is kind of reducing right now, even in this area. If you look closely,
But I can
it's
feel
not
it.
so big anymore.
I can feel it again.
Again,
Now.
the pain.
No, I can feel it. It was numb before.
Oh,
I couldn't feel anything.
huh. So what we're gonna use is this normal saline bacitracin ointment for antibiotic ointment, and then nasal spray to keep it moisturized. Let's start. So I already washed my hands and used alcohol.
So like I said, I stopped taking the pain meds last night. I took 2 30 milligram codeine earlier in the evening last night, but then around 9 p.m. I just took 1. And today so far nothing. Try it up higher. Yeah. There you go. Felt
Can you
that one.
taste it?
Yeah. It's like salt water. Ooh.
Also, whenever you're cleaning the nose and the suture side, you have to be careful not to go so much inside.
Don't even go inside at all.
Yeah, just try to clean it from the side or the outside part lang.
So this is Friday evening, so the evening of the 4th day. I've still got swelling on my eyes. My nose is still plugged up. Can't breathe through it. The throat is better, but I still got black eyes and the splint. And the wound on my chest is getting better. I don't cover it anymore, and I don't wear the bandage underneath. There's not any drippage. And I'm more clear-headed. I stopped taking the opioids, the codeine, but still uncomfortable.
Alright, and we're back with another cleaning episode.
Friday night. Night
Only
of the
Friday
4th.
night. Try to get in here.
Oo.
Do you remember pa the girl in the operation?
I don't remember anything.
They went in here, in the top
Yeah.
part.
I remember going in, making a little bit of bula talking, and then the lady said, we're going to turn your IV on now.
Huh?
Nasaraduhan yung tube.
Maybe that's why they put me to sleep
Ay
on
lang,
this.
kasi dito ko nilagay siya.
Ayun, nasaraduhan siya.
Yan siya. Kasi nandyan nga yung may dugo eh.
Iangat mo, hindi ko namang labasan yung ano.
Hindi naman siya humihinga dyan. Can I see na? Dito. Yan.
The nurse is yelling.
The director of nursing at the house.
Pumasok na.
Saraan.
Pumasok na. Umano na dun eh.
Yun yung butas eh.
Hindi ko na matatanggal. Hayaan
Gotta
mo na.
take Kevlar soon too.
Hayaan mo na. Mag-mouth yan mamaya.
So here's my bedside table. This is highly recommended. It's a glycerin moisturizing gel for your mouth because you're not going to be able to breathe through your nose, and you really get the most horrible dry mouth you've ever experienced. So this is really good. There's a mouthwash too, but this is the main thing. I use this several times a night when I wake up. And they gave me acetophenamine with codeine, and really I haven't needed it after the first 3 days. They don't write codeine on there, but I took the first 3 days I took 2 pills every 6 to 8 hours, but there's really not heavy pain. It's just more uncomfortableness. This is the what do you call it, antibiotics, which I've been taking. And then I got hydrogen peroxide to clean the dried blood off my nose. And then the hospital gave us some little gauze pads to use. And of course, chapstick, eye drops, Q-tips, and the antibiotic ointment for the wound. I got some wet wipes, some tissues. That's pretty much it. And then I try to sleep elevated, but I'm not very good at sleeping elevated, so usually when I wake up I'm all the way down and my face is swollen. And you can see, so this is Sunday now, so 5 days after the operation. I had the operation Tuesday, and now it's Sunday 4 p.m. So the swelling is down, but the color is still there on my eyes. And I think the nose swelling is down a little bit, and it feels different. There's no pain, it's just more uncomfortable. It's hard to explain. I think because the nose is shrinking, that the stuff that's in there is being constricted more. You can see there's 2 hoses, 1 hose on each nose, and I still can't talk right. It's hard to eat too. The first couple of days I couldn't really open my mouth much. I could actually open my mouth a little more. If I open it too far, you can feel it pulling the stitches on the nose, so I'm trying not to bother it at all. So I don't eat things that I have to chew hard or a lot. Mainly been sticking with soup, ice cream, oatmeal, things like that. So this is day 6. I had the operation Tuesday, now it's Monday morning. And there's really not much difference. I still got this stuff in my nose. I get it removed tomorrow. I'm still taking the painkillers, but not as much, and mainly it's because of the uncomfortableness. There's no pain, but just having all this stuff up in your nose is very uncomfortable. And despite the operation being 6 days ago, it's still hard for me to do things that I normally would do. Like I tried to cook dinner last night, and after a few minutes my throat started hurting, like almost like a sore throat. Got thirsty, a little bit lightheaded, so I had to sit down, which surprised me, but that's how it is. So hopefully we get the stuff taken out tomorrow, and that'll be a big pain reliever. And the nose is very sensitive still. I still have the jaundice looking color on my eyes. I was able to lay down mostly last night and sleep good, so that was okay. It's the morning of the 7th now, so exactly 1 week ago today I had the operation. I'm getting the packing and tubing removed today. I'm heading in now, maybe half an hour, so we'll see what happens. I stopped taking my antibiotics, my last pill today, and because of the appointment, I don't know what to expect. They're going to remove everything. I don't know how painful it's going to be, if at all. But I did take one of my last codeine pills just to be safe. Because, I mean, it's pretty sensitive right now. I can imagine reaching in there and moving stuff around. Overall, I have some bruising still, but it's kind of gone down to my cheeks, which is weird. I'm not able to do things normal yet, like driving is still a little weird. Cooking dinner, just running around doing errands. Like I went to the grocery store last night and got dizzy and winded. I get exhausted easily still. I hate to sit down on the sofa all day or lay on the bed, but sometimes it's what you have to do. But anyways, we're going in now, and my next update will be once everything is removed. And I'm not expecting a big unveiling moment. You know, the nose isn't going to be that much different. It was mainly for non-cosmetic reasons. So, see you then.
Give it time for everything to kind of settle down a little bit, but it looks good.
Do you think it's okay to use a CPAP machine now? Because it only barely touches the bottom.
If it's barely touched the bottom, then it's okay.
Mainly it's
anything
the mouth.
that needs pressure, I would say.
No, it's just
okay.
it touches the bottom and then it blows. Still swollen.
It's nicer than your old nose.
No, she's seen it before, but it was for.
So you want to
June.
So my private nurse is going to do a cleaning. The first cleaning since the tubes were removed. Oh, that's so bright. You really need that? Can you turn it down a little? Sure. So that's on. There. One of those little round cotton.
Papa, don't talk too much. Just wonder. No, I'm just doing it slowly. Oh, really a lot of bubbling now.
Hi, today is Wednesday, 1 week and 1 day after the operation. The swelling on the cheeks has gone down, but the nose is still swollen. And when they first took the tubes out yesterday, I was able to breathe pretty good. But since then, like today, it was just really swollen up. I couldn't breathe through the nose at all. So it's gotten a little better in the evening, but it was just horrible earlier today. I wanted to go out and do stuff today, but around noon, I just got so tired and dizzy. I just laid down. I don't know if it's the after effects of the anesthesia. It couldn't be, right? That was a week ago. Or just the trauma of the operation. I don't know, but I was really tired and dizzy today. So I just ended up staying home in bed. So, the nose is still pretty sensitive. It feels hard, like it's hard to open my mouth. Or like I can't scrunch my nose or anything. Because it feels like it's injected with Botox or something. So, anyways, just a quick update. Hey, so another quick update. Today is Saturday, so 11 days after my original operation. My throat is good. Still a little bit lightheaded. Every now and then I'll stand up fast and have vertigo. So I still haven't been able to really go out and do active lifestyle stuff like I used to. The nose is a little bit better. I think the swelling's gone down a little bit, but like it feels numb here, and it isn't open all the way, so you can tell. So after 11 days, my nose is still pretty much closed. I've been putting the saline spray in it and the antibacterial gel around the wound. Other than that, I mean, see a side profile. It looks okay. It still looks, to me, swollen, bigger than it should be, and it looks crooked even a little bit. It looks like it's being pushed one way, but I mean, it's only 11 days, so reading online, it could be up to 3 months before the nose really settles down to where it should be. I have a follow-up appointment in 3 weeks to the doctor, so I'll let her look at it and tell her anything that's going on, my concerns. So I'll check in then. Bye. Hey, today is 16 days after the operation, 2 weeks and 2 days. So my throat is good, a little bit of vertigo still when I lay down or stand up fast. The nose is pretty good, sensitive, still swollen, sensitive on the outside. I still can't breathe on this side. So honestly, I haven't noted any improvement yet, but that's ridiculous. It's only been 2 weeks. They said it could be up to 3 months before I really see any results. But as of now, I can't breathe through this one, so really no change at all. I'm back to work now after 2 weeks. I had to lay off any physical stuff. Mainly I have a desk job anyway, so it's okay. Other than that, I'm going to close the video for now because there's really nothing new going on. I'll do an update if there's anything noticeable that I can report, but So far, so good.